Abdomen&Pelvis. Today's topic is going to be the gross anatomy of kidney. Kidneys are basically the organs which are reddish brown in color, and they appear to be reddish brown, and they are lying on the posterior abdominal wall behind the peritoneum. That's why they are called retroperitoneal. When it comes to their location, the kidneys are covered by the costal margins, and their vertebral levels include from 12th thoracic vertebra till 3rd lumbar vertebra. The right kidney, because of the presence of the right big lobe of the liver, lies a little bit lower than the left kidney. And both the kidneys on their supramedial aspects, they are in contact with the suprarenal glands. The coverings of the kidney, each kidney has a few coverings or layers that surround it. These coverings for a medical student are very important to know because they are often asked in the Viva examination and in the MCQs part of written examination. And if the students and the exam concerned university also includes the short essay questions, which are famously known as SAQs, such universities often give a note on the coverings of kidney in their SAQ part of written examination. So the coverings of a kidney from inside to outside include a closely adhered layer of fibrous capsule. Outside it is a layer of fat known as perinephric fat. Further outside it is the renal fascia, which is basically the condensation of the surrounding connective tissue. And most outwardly, we have the extraperitoneal layer of fat known as the perirenal fat. In the diagram, you can see each of these layers, they are given or assigned a specific color. From inside to outside, the kidney is shown to be yellow in color, and outside it is a blue layer, which represents the renal capsule. Further outside it is the perirenal fat, and more outside it is the renal fascia, here highlighted in the red color. And further outside and more obvious on the posterior aspect of the kidney is the pararenal fat. Fibrous capsule is found to be closely adhered to the surface of each kidney, and they just surround the kidney. Outside the fibrous capsule, we have perinephric or perirenal fat, which surrounds the kidneys and the renal vessels. You can see here that here we have a closely adhered layer of fibrous capsule, closely adhered to the outer surface of a kidney. And outside it, we have the perinephric or the perirenal fat, which is extending up to the attachment of the renal vessels in the hilum of the kidney. Renal fascia is formed by the membranous layer of the renal fascia around the kidneys, and this fascia and the layer of this fascia encloses the kidneys, suprarenal glands, surrounding fat, renal vessels, and it also extends downwards and medially to form fascia for the ureters, known as periureteric fascia. Here you can see in this diagram the renal fascia, how it is surrounding almost the whole kidney and its neighboring structures. Further outside the renal fascia, or the outermost layer in the coverings of the kidneys, is the paranephric fat, which is basically, practically, more or less, is the extraperitoneal fat present in the lumbar region. And it is found to be more condensed and more pronounced in the posterior aspect of the kidneys. Moving on to the gross features, also known as external features of a kidney. Each kidney has at least two surfaces, anterior and posterior, two poles, since it's a bean-shaped structure, so it has two poles, an upper pole and a lower pole, borders, a lateral outer convex border, and inner medial slightly concave border. And it is this border, medial border, which bears a concave depression on its aspect called the hilum. Hilum is the area which bears the entrance or the exit of the structures entering or exiting the kidney, known as the renal vessels and ureter. If we cut the kidney sagittally, so that you can see, as in this diagram, the inside or the internal structure of the kidney. It comprises of an outer dark brown cortex and an inner light brown medulla. The medulla comprises of various pyramidal shaped structures known as simply the renal pyramids. The base of each of these pyramids and the renal medulla faces the cortex, and apex faces towards the hilum. Which is located medially. The apex of renal pyramid is also known as renal papilla. The part of the cortex projecting into the medulla between these pyramids is known as the renal columns. From the bases of each of these renal pyramids, the striations that seem to be entering from these renal pyramids into the cortex of each kidney are known as medullary rays. Coming on to the hilum of the kidney, there is a space known as renal sinus. This renal sinus is a space within the hilum of the kidney that contains the upper expanded part of the ureter known as renal pelvis. This space, renal sinus, is very important for the future doctors to know about because very often it is subjected to development of infections leading to inflammation in this space. Now you can see in the diagram the renal pelvis within the renal sinus is seen to be dividing into smaller subdivisions. These subdivisions are known as major calyces. These are about 2 to 3 in number. So here you can see this major calyx, this and this. Each of these major calyces further divides into 2 to 3 minor calyces. And each of these minor calyces, as is visible in this diagram, each of these minor calyces is indented by the apex of the renal pyramid, which we later mentioned to be, or which we later mentioned as papilla, renal papilla. Now the relations of the kidneys, again, from examination point of view, these relations are very commonly asked in the short essay questions, and they are not only asked to be described, but also to be drawn. So the question is often asked as draw and label relations of the right kidney or left kidney. And when it comes to a descriptive question, the question can be write down the relations or enumerate the relations of either both kidneys or one kidney could be asked. Relations of the right kidney, anteriorly we have the suprarenal gland, liver, second part of the duodenum and right colic flexure. And for the left kidney, anteriorly we have the suprarenal gland, spleen, stomach, pancreas, left colic flexure, and jejunum. The posterior relations for the kidneys are pretty much the same, except a few differences because of the level of each kidney. So the right kidney posteriorly is related to the 12th rib, but the left kidney is related also to the 11th rib. So 11th and 12th ribs for the left kidney and 12th rib for the right kidney because it is lower than the left kidney. Diaphragm in both cases, costodiaphragmatic pleurosis again in both cases, vas major, chordatus lumborum, which are the muscles of the posterior abdominal wall. And among them, the psoas major lies more medially and chordatus lumborum is supposed to be the lateral muscle in the posterior abdominal wall. Then we have the transversus abdominis, which forms part of the anterolateral abdominal wall muscle. In case of right kidney, we have very often, or rather less often, the subcostal, but more often we have the iliohypogastric and ilioinguinal. But for the left kidney, subcostal nerve will also form a posterior relation in addition to iliohypogastric and ilioinguinal nerve. So basically, the difference comes in case of ribs and the subcostal nerve. In this diagram, certain impressions on the kidneys are shown. Again, these impressions are left by those structures that also form relations with each of these kidneys. In case of right kidney, on the anterior aspect, majority of the upper anterior surface is covered by the liver, so it is known as the hepatic area. More medially towards its hilum, staying on the anterior surface, we have the duodenal area, and below it, towards the lower pole, we have the colic area. For the left kidney, we have a smaller upper area. Middle is the stomach area, known as the gastric area. Then we have the splenic, more towards the lateral border, and the pancreatic area, more towards the medial border. And lower pole, majority of the lower pole is covered by the jejunal area, and a small portion, again, lower lateral aspect is covered by the colic impression, known as the colic area. These areas are often asked in the viva examination. Moving on to the blood supply of the kidney. In the gross anatomy, a student is supposed to know the name of the branches arising from the renal artery. So the renal artery is the branch of aorta arising at the level of the second lumbar vertebra. Again, these vertebral levels for a student of anatomy are very important, and they are often asked in the MCQ examination of the profs. So after the renal artery arises from the aorta, each renal artery divides into at least 5 segmental arteries. In this diagram, you can see here we have the renal artery. Now the renal artery is dividing into segmental arteries. There are at least 5 segmental arteries, and these arteries enter the hilum. Now in the hilum, lobar arteries, they are given off, and which further divide into 2 to 3 interlobar arteries. These interlobar arteries are given off by the lobar arteries before the lobar arteries enter the renal substance. So here in the diagram, you can see the interlobar arteries. These interlobar arteries are seen to be coursing towards the cortex on each side of the renal pyramid. At the junction of the cortex and medulla, the interlobar arteries give off arcuate arteries. Arcuate arteries in this diagram are shown here over the bases of each renal pyramid. Now the arcuate arteries, they give off a number of interlobular arteries that ascend into the cortex. From there, the afferent arterioles arise, and finally, through the efferent arterioles and peritubular capillary plexus, now the blood will be drained by the veins. Finally, the renal vein emerges from the hilum in front of the renal artery. So in the hilum, the anteriormost structure is the vein, next to it is the artery, and more posterior, we have the ureter. The renal vein, it drains into the inferior vena cava. Nerve supply of the kidney is supplied through the splanchnic nerves, which are responsible for the vasoconstriction of the renal blood vessels. The kidneys also receive parasympathetic input through the vagus nerve, and the sensory input from the kidneys travels to the 10th and 11th spinal cord segments. Lymphatic drainage for the kidneys comprises of the lymphatic vessels that follow the renal artery, and finally drains into the lateral aortic lymph nodes around the origin of the renal artery.